So here is the upper esophageal view of the next patient selected. I'm going down to show you the mitral valve, and I'm going towards the tricuspid valve. Tricuspid valve is poorly visible also in transesophageal echo, and usually we cannot really see the leaflets very well. In order to learn better the anatomy, we created colored motion. We call it enhancements. And then the leaflets are, as you can see, enhanced with the color. The septal leaflet is visible in yellow, anterior leaflet in blue, and the posterior leaflet is visible in green. And now I'm just showing you how to differentiate the leaflets depending on the angle of the probe. Here it is visible in 4-chamber view with relatively anterior position of the plane. And once I rotate the bigger knob counterclockwise, you can see the posterior leaflet. So by rotating the bigger knob counterclockwise, I'm flexing the probe posteriorly, and then I can see coronary sinus and the posterior leaflet, as well as septal leaflet. If I go more anteriorly by releasing the retroflex or even making it slightly antiflex, you can see that I section now the septal leaflet and the anterior leaflet. Let's have a look how it looks like in 3D, because this will give you an idea how the anatomy of the valve looks like when we want to learn it nicely. So here is the 3D image of the two orifice. On the left hand side we have the mitral valve, on the right hand side we have the tricuspid. And here you see that the septal leaflet is located near the interatrial septum. It has the commissure with the anterior leaflet close to the aortic valve, and the posterior leaflet is located posteriorly, of course, where the coronary sinus enters the right atrium. So where the coronary sinus is located, we see the posterior aspect of the septal leaflet close to the commissure between the septal and the posterior leaflets. So here's the anatomy we have to learn before we go into the details of this anatomy. When I now position my valve here in the center, I can change the angle of the plane to approximately 90 degrees. And here I have this image, which then can be used together with the X-plane to show in the long axis here, long axis view of the valve with the septal and anterior leaflet. But if I tilt this towards here, I can see the septal and posterior leaflet, and it's very useful both in scanning the valve but also when doing the intervention on the tricuspid valve. Here's the coronary sinus, which corresponds to the posterior position of this plane, explaining also why this leaflet is posterior one. If I go slightly deeper, I will just switch off the X-plane for a while. I'm going to show you the transgastric view of the tricuspid valve. I have to do some antiflex and also a right flexion of the device in the esophagus. And here you see 3 leaflets at the same time. This is very difficult view to obtain, but this is how we can learn how to obtain it if we have this simulator here. So here we have the short axis view of the valve, and again using the X-plane we can see the long axis of the corresponding leaflets. If I deactivate again the X-plane, I can go to the deep transgastric views. So I go to 0 degree, I go to the stomach, I do huge antiflexing, and then I go here to see the base of the right ventricle. And here I have my leaflets. Again, they are colored, so it's easier to understand which leaflet is which. And to scan it with my X-plane, helps understand where I am and what I can do with this leaflet if I do the intervention.